Sexually transmitted diseases, or STDs, are infections that are spread primarily through sexual contact. They can affect anyone who is sexually active, regardless of age, gender, or sexual orientation. This includes vaginal, anal, and oral sex. It's important to understand that any form of sexual contact can potentially transmit these infections. STDs are a significant public health concern, affecting millions of people worldwide. The impact of these infections is not just limited to physical health, but also extends to emotional and social well-being. These infections are caused by various organisms, including bacteria, viruses, and parasites. Each type of organism requires different methods of treatment and management. STDs can have a wide range of symptoms, from mild discomfort to serious health complications. Symptoms can vary greatly depending on the type of infection and the individual's overall health. Some people may experience no symptoms at all, making it possible to unknowingly transmit the infection to others. This asymptomatic nature of some STDs makes regular testing even more critical. This is why regular testing is crucial, especially for those who are sexually active. Early detection can prevent the spread of STDs and allow for timely treatment. The good news is that many STDs are treatable, particularly those caused by bacteria. Early diagnosis and treatment can prevent long-term health issues. Antibiotics are highly effective in these cases. However, it's important to complete the full course of medication to ensure the infection is fully eradicated. However, viral STDs are often managed with medications that control symptoms rather than cure the infection. Ongoing medical care and monitoring are essential for managing these conditions. Prevention is key when it comes to STDs. Educating yourself and your partners about safe sex practices can make a significant difference. Safe sex practices such as using condoms, getting vaccinated, and getting tested regularly are essential steps in protecting yourself and others. Can significantly reduce your risk of contracting or spreading these infections. Remember, taking proactive steps towards prevention and regular health checkups can lead to a healthier and safer sexual life. Chlamydia and gonorrhea are two of the most common bacterial STDs, often causing no symptoms in the early stages. This makes them particularly dangerous as individuals may unknowingly spread the infection to others. Chlamydia can lead to pelvic inflammatory disease, or PID, in women if left untreated, potentially causing infertility. PID can result in chronic pelvic pain and increase the risk of ectopic pregnancy, which can be life-threatening. Gonorrhea, if untreated, can cause serious health problems in both men and women, including joint pain, heart problems, and meningitis. In men, it can lead to painful conditions in the tubes attached to the testicles, potentially causing infertility. Syphilis is another bacterial STD that progresses through different stages. The initial stage is marked by a painless sore, often unnoticed, followed by a rash and flu-like symptoms in the secondary stage. It initially presents as a painless sore but can lead to severe complications if left untreated, affecting the heart, brain, and nervous system. In its late stages, syphilis can cause damage to internal organs and even result in death. Thankfully, syphilis is curable with antibiotics, especially in its early stages. Early detection and treatment are crucial to prevent long-term health issues. Trichomoniasis, caused by a parasite, is another common STD. It is often overlooked because its symptoms can be mild or mistaken for other conditions. It often presents with symptoms like vaginal discharge and itching in women, while men may experience no symptoms. This asymptomatic nature in men can contribute to the spread of the infection. If you suspect you've been exposed to any of these STDs, it's essential to get tested and treated promptly. Regular screenings and practicing safe sex can help prevent the spread of these infections and protect your health. HIV, the human immunodeficiency virus, attacks the body's immune system, making it difficult to fight off infections. If left untreated, HIV can lead to AIDS, or acquired immunodeficiency syndrome, a chronic, life-threatening condition. HIV is transmitted through bodily fluids like blood, semen, vaginal fluids, and breast milk. There is no cure for HIV, but with effective antiretroviral therapy, or ART, people with HIV can live long and healthy lives. ART reduces the amount of HIV in the body, preventing the progression to AIDS and reducing the risk of transmission to others. Genital herpes, caused by the herpes simplex virus or HSV, is a common viral STD that causes painful sores and blisters. These sores can appear on the genital area, buttocks, and thighs, and can be quite uncomfortable. The virus is highly contagious and can be spread through direct skin-to-skin contact even when sores are not visible. While there's no cure, antiviral medications can manage outbreaks and reduce the risk of transmission. These medications can help to shorten the duration of outbreaks and make them less severe. Regular use of antiviral therapy can also decrease the likelihood of passing the virus to sexual partners. Human papillomavirus, or HPV, is a group of viruses with over 100 different types. Some types of HPV can cause genital warts, while others are associated with various cancers, including cervical, anal, and throat cancers. Some of which can cause genital warts and increase the risk of cervical and other cancers. Regular screening and early detection are crucial in managing the risks associated with HPV-related cancers. Vaccination against HPV is available and highly effective in preventing these infections. The vaccine is recommended for preteens but can also be given to older individuals who have not yet been vaccinated. Hepatitis B and C are viral infections that affect the liver. These infections can lead to serious liver damage, including cirrhosis and liver cancer, if left untreated. Hepatitis B is primarily transmitted through sexual contact, as well as through contact with infected bodily fluids such as blood and semen. While hepatitis C is spread through contact with infected blood, this can occur through sharing needles, blood transfusions, or other forms of blood-to-blood contact. Vaccines are available for hepatitis B, which can provide long-term protection against the virus, and effective treatments exist for both types of hepatitis. These treatments can help to manage the infection and prevent serious liver damage, improving the quality of life for those affected. Section 5. The importance of prevention and early detection. Preventing STDs is crucial for protecting your health and the health of your partners. Open communication with your partner or partners about sexual history and testing is essential. Regular STD testing is vital, especially for those who are sexually active with multiple partners. Early detection allows for timely treatment, preventing the spread of infection and potential long-term health complications. Section 6. Protecting yourself and your partners. Condoms, when used correctly and consistently, are highly effective in preventing the transmission of many STDs, including HIV. They act as a barrier, preventing the exchange of bodily fluids during sexual activity. Vaccines are available for HPV and hepatitis B, offering significant protection against these infections. Vaccination is most effective when administered before becoming sexually active. Limiting your number of sexual partners can reduce your risk of exposure to STDs. The fewer partners you have, the lower your chances of encountering an infected individual. It's essential to avoid sharing needles for any reason, as this practice can transmit bloodborne infections like HIV and hepatitis C. Section 7. STDs, beyond the physical impact. The impact of STDs extends far beyond physical health. These infections can have profound psychological and social consequences for individuals and their families. The stigma associated with STDs can lead to feelings of shame, guilt, and isolation. It can strain relationships, making it challenging to discuss sexual health openly and honestly. It's crucial to remember that anyone can contract an STD, regardless of their age, sexual orientation, or background. Open communication, education, and access to healthcare are essential for breaking down stigma and promoting sexual health. Section 8. STDs and women's health unique considerations. Women are disproportionately affected by STDs, with infections like chlamydia and gonorrhea often causing no symptoms but leading to serious complications if left untreated. Pelvic inflammatory disease, a potential consequence of untreated chlamydia or gonorrhea, can cause chronic pelvic pain, infertility, and ectopic pregnancy. Regular gynecological checkups, including STD testing, are crucial for women's health. Early detection and treatment can prevent long-term complications and protect fertility. Section 9. STDs and pregnancy safeguarding maternal and fetal health. Some STDs can be transmitted from mother to child during pregnancy or childbirth, posing risks to the health of the baby. HIV, for example, can be passed on to the baby during pregnancy, labor, or breastfeeding. However, with appropriate medical care, including antiretroviral therapy, the risk of transmission can be significantly reduced. Pregnant women should be screened for STDs early in pregnancy to ensure timely treatment and protect both mother and baby. Section 10. The challenge of antibiotic resistance. The rise of antibiotic resistance is a growing global health concern, and STDs are no exception. Overuse and misuse of antibiotics have led to the emergence of drug-resistant strains of gonorrhea, making treatment more challenging. Antibiotic resistance highlights the importance of preventing STDs in the first place. Safe sex practices, vaccination, and regular testing are crucial for reducing the need for antibiotics and slowing the spread of resistance. Section 11. Public Health Imperative, Awareness, Access, and Action. Addressing the public health challenge of STDs requires a multifaceted approach that includes raising awareness, improving access to testing and treatment, and promoting prevention strategies. Comprehensive sex education that is accurate, age-appropriate, and inclusive is essential for equipping young people with the knowledge and skills to make informed decisions about their sexual health. Public health campaigns can help reduce the stigma associated with STDs, encouraging people to seek testing and treatment without fear of judgment or discrimination. Access to affordable and confidential healthcare services, including STD testing and treatment, is crucial for controlling the spread of these infections.